Hi there, my name is Brooke Sutter and I'm a tattoo artist in Madison, Wisconsin. I am starting this little kind of video series to try to uplift and help and support other creatives who are entrepreneurs and entrepreneurial spirits who are trying to find their way. I've spent a lot of time trying to dig up resources for myself, and I figured it's super important to share those, especially because so many of them are not well known. And so today I'm talking about something super boring, so sorry about that. But the topic of health insurance as an entrepreneur. And this is all in the US. I don't speak for anything outside of the US. But health insurance is such an interesting topic because a lot of tattooers, at least like old school vibes, are like, yeah, screw that. I don't need insurance. I just won't pay for whatever. But I feel like as we're all growing, getting older, people are starting to have families, it's like you can't operate on that basis necessarily with your family. And so I have some resources that I figured would be super helpful to at least know about, and you can make your choice from there. This would probably also be helpful for, like if you are a hairdresser or a barber and you have your own spot, or any type of artist or anyone who doesn't, follow the classic 9 to 5 who gets health insurance. And even if you do get health insurance from your 9 to 5, it could be really crappy and you want an alternative. So I'm going to talk about 3 things today. One of them is the DPC, or the direct primary care model in the health world. The second one is health cost sharing, and a company called SEDERA, and there's also a lot of other companies too, specifically, interestingly, like ministry religious ones, which not all of us are on that path. So the cost sharing world in general. And then thirdly, I'm gonna share an option for like mental health resources, and finding affordable therapy, because those 2 words do not go together generally. So back to the first element, which is the DPC, the direct primary care model. So as most of us know, like finding a primary care physician within the realm of a like you have classic insurance, or you went through the marketplace, or you're under 26 and you're still on your parents and you have a primary care physician. That's many people are waiting, many months to get in for just a normal physical. So the DPC model is basically, instead of going through an insurance company, you are working directly with the physicians. And these models are starting to pop up and become more and more common. And some of them are just one physician who has their own practice. Others are groups of multiple physicians. Locally in my area, I have worked with a couple different ones, and one of the ones I used to work with had, I think, over 5 different doctors. So they had expanded into a pretty solid practice, whereas another one I've worked with is just one doctor. But basically you pay a monthly fee regardless. Like, it is kind of like insurance that way. You pay an amount every month, and you this covers all of your costs with them, so you don't ever have to go in and pay $10 like a copay. There's no copay. This is kind of your monthly copay. And the perks are you wait much less time to get an appointment. You get better care because the doctors have a way better setup too. They aren't dealing with thousands of patients. They can afford to have a smaller load of patients, and give their attention to their patients in a much more balanced way. So you're not having a burnt out doctor who is barely remembering who you are. Actually, if a doctor remembers who you are, it's almost like surprising sometimes. And this fee honestly can range. A place that I used to be, it was $66 a month, and the new place that I'm at is $88 a month. And it can maybe range based on your age, but I honestly don't think so. I don't think it's super varied. And this, includes your costs of the actual appointments themselves. And it often involves you getting deep discounts on blood work and if you need a prescription or supplement or something like that, they can give you sincere discounts because those things can be really expensive. So it's nice to have that hookup too. And some DPCs also are big enough or set up in a way that you can have small procedures done there, and that is often included in your monthly fee, or at a deep discount too. Like I remember getting a couple of moles removed and I paid nothing for them because they were able to do that in office. That is not true of every DPC, but it's good to dig in and research and see if your DPC offers anything like that. I also remember getting a couple of physical items done in like blood tests or other tests, and those being like kind of small procedural, but also with deep discounts. So 100% way better. And I remember, waiting less than a month to get in for my appointment of like a physical. So this isn't even like I'm sick, I need to come in right now to get diagnosed, or like, within a week if I had strep throat once and they were like, okay, yeah, we can get you in. So amazing to have that opportunity. I mean, depending on what area you're in, I think just Googling DPC or direct primary care and your location and see what comes up. They are growing in popularity because it's better for everyone. And yeah, the only thing is it's separate completely from insurance. So if you do have insurance, there's no guarantee that things will work together, but that's also something you can inquire with them about, because some might have a little overlap of being able to work together. Your insurance will never cover like the DPC monthly fee, I'm quite sure though. And of course, if anyone has any questions, you can comment or yeah, I feel like commenting might make sense. I don't know how far and wide I'll share this, so we'll see. Just making sure I've checked off all the things I wrote down. Okay, yeah. So the second part of the health insurance picture is like the catastrophic care category. So DPCs are not involved with that. So let's say you get sick and you're sick for a week, yes, go to the DPC. But if you break your leg or have a larger need, or you have some chronic condition, or you need a specialist, those types of things, those are not DPC in the picture of the DPC. So you would have to pay out of pocket for those things, which not super fun. And so there's a second kind of tier that works really well together with the DPC model, and that is the cost sharing model. And this began many years ago. I don't have an exact date, with in kind of like the ministry world of health and the religious, like people who are religious came together and they said, I want to be able to help support my fellow religious people, and we can pay for each other's medical care. And then it got really popular, and eventually people were like, wait a minute, I'm not religious, but I want to be part of this, like a group that is supporting each other with medical costs. So the company that I work with, which honestly, it probably sounds like I'm sponsored or something, but they don't know I exist other than that I work with them, so nobody's paying me to say anything. I just really want to support people into having an option so they don't get crippled by their medical debt. Is SEDERA, and they, I believe, modeled their like business off of the medical cost sharing world that began in the religious world. And so basically it's a company that keeps organization of all of these millions or tens of thousands, however many people coming together to make a big pile of money. And then when somebody has a need, like a health need, then they get money to get through that need. So it works so much like insurance though, because there's a quote unquote deductible. It's not a deductible, but it's like a deductible where if you have a need that is, you know, let's say $10,000 and your deductible is $2,500, you have to pay that base amount, the $2,500, and then they cover the rest. But you can choose your deductible, although I'm probably not allowed to call it that. You also pay in monthly. So it's like basically the same thing as DPC, but it's separate and they kind of work together. And I feel like I'm all over the place right now, but I hope this is understandable. The monthly fee is also usually based on age and level of health, which is kind of annoying, but it's the world we live in. Mine right now, for example, is $188. So, which in the scheme of things, so if you like add up $188 plus, I don't know, like whatever my DPC is, $85, it's still under $300 a month. And before I found out about this, I was paying $300, over $300 a month. And this was like in 2020 for the bottom of the barrel catastrophic plan. Like, you know, truly, if if something super terrible happened and you went to the hospital, they'd cover it, but otherwise not. And it was probably a very high deductible too. So for less than that, I'm getting way higher care. Let's see here. This includes almost everything that is not the DPC. So like I said before, the specialist visits, the breaking the leg, the, hospital stay for one reason or another, anything like that is in this category. And these are the costs that can get like insurmountable very quickly and would be extremely overwhelming if you didn't have something like this to help cover those costs. There are exceptions to what they cover, and to me they seemed reasonable for what I was paying. One of them is maternity care. I don't know if there's a potential for a separate plan where you are paying higher per month to get that. I'm not 100% sure. Secondary is dental. This does not include dental. And there's a really big packet that they sent me when I signed up, and it was like, if you had questions about certain things, you'd go look in this packet, in this list, and see what their approach was, or if there was an exception to that coverage. Usually when what I looked up, it made a lot of sense and didn't feel weird or confusing. It was like, okay, this qualifies, this doesn't, and it felt very fair. And one of my other, favorite things about the medical cost sharing is, well, it's like you're supporting other people, you're all supporting each other. And because the company is, is working with this limited pile of money that we've all paid in, they really have deep incentive to advocate for you, for your care in the hospital or wherever you're going. They want to make sure that, like, they want to make sure that you're getting the right care so that this doesn't happen again, or that it doesn't turn into something that ends up costing everyone more. They'll fight with the hospitals about the your itemized receipt for you, which is truly a nightmare in hospitals. Just like bing bang boom, put more things on that aren't necessary. So they call, they do the arguing and are like, hey, what does this cost? Can you prove to me that we actually need to pay it, or did you just put it on there because you're a hospital and you're like that? And I love that part, because when people are sick or going through something that needs hospital or larger support, it's really hard to have the energy to advocate for yourself. Not everyone has like a powerhouse family member that can do it for them, or anything along those lines. So I love that they are very deeply ingrained in the process, and they're willing to go to bat for you. They also will put in the legwork to do research of, like, if you need a surgery, where you can go that you'll get the best care for the best price. And they'll, like, this could possibly involve you flying across the country, but the costs are still it's just like still a big picture cost. As long as you meet your minimum or like your deductible, then it's in the cost sharing picture of what they'll cover. So I feel so fortunate and lucky that I found out that they exist, and it's just wonderful. I will link them below too, and I'll do a little more research and link some other companies as well. And they've been around for a while, and they've been, I don't know, under the radar for whatever reason. Maybe that information is being suppressed and there's a conspiracy because it's not good for insurance companies. I don't know, but I do love a good conspiracy. And yeah, I love them. Also, if there's any questions about that, shoot them down below for sure. The third thing I wanted to talk about is therapy, because the other thing that SEDERA, the cost sharing company, doesn't include is therapy. And it's like, obviously therapy is lower cost than meeting most people's deductibles, so that's one thing, but it's just separate from medical care. This is mental health care. And I found out about this collective years ago. This was in 2017, I believe. I don't know how I found out about it, but I'm super grateful. And they're called Open Path Collective, and it's a website where many therapists from all over the United States, it could be beyond, but I think it's mostly the US, come together to offer their services for reduced rates to people who need it. People who don't have insurance, and people who can't afford $150, $200, $250 per hour of therapy for like one session. Who can do that? If you're going once a week, that's like, so much money. It could be like, $600 to $1,000 or whatever a month, which is insane. And obviously these therapists deserve to be paid for their work, because it is very, very hard work. But these therapists get to choose, like, maybe they can offer this service to one client or two or however many, and they put their services up, they agree to it. They're the ones that are like, yes, I want to offer my services for low. I did this starting in, I did the search in the end of 2017, and then in 2018 I started with a therapist, and literally I've been with her for 8 years, and I just feel like my life has been transformed by this, and I want to shout it from the rooftops. And I feel like I talk about it all the time, and it's still not enough. Like, I'll bring it up to somebody else, and they will be like, what? I didn't know this existed. So somehow some way we need to spread the word. And these sessions, so the therapists offer the sessions from $40 to $70 per visit. So obviously still not super cheap and still not perfect, but compared to $150 or $250 an hour, it is amazing. And even if you can only do one per month, or there's a balance where it feels accessible. And I also know most people don't go to therapy for years and years and years. Sometimes it's a few months of support. Sometimes it is almost a decade, like me. And it's just nice to have someone in your corner to support you through whatever waves life kind of presents you with. There is a $65 fee to become a member of the collective to get access to the information, which I'm kind of like, that's kind of annoying, but obviously behind the scenes they're doing a lot to get everyone's profile up, get all the information up there. So I figured it was, and it's a lifetime thing. So like if you start with somebody and then things are cool and then you stop and then you're like, ooh, I need to start up again, and you come back, like that lifetime fee it lasts forever. So you're good there. And I feel like they honestly lowered it. I feel like it used to be $100, so good for them. Also, you can get an even lower rate of $30 per session if you choose to work with like a student intern therapist, which everyone's got their decision. Might be better than nothing, might not, but I figured I'd throw that out there. Yeah, and I'll link that below too, but it's called Open Path Collective. The really nice thing about it as well is you can see a picture of the therapist, which honestly love it, super helpful. Sometimes you can just resonate with an image of somebody, and then they have a blurb that they've written about themselves, and a list of their specialties or what they have the most skills in, or even different like styles of therapy. Like, there's cognitive behavioral therapy, and then like the talk therapy, and then there's somatic therapies, and there's like a Jungian analyst, or somebody who specializes in marriage and family, someone who specializes in helping people deal with grief, and just everything you can think of. And I loved that too. I think this maybe also helped me to choose the therapist I resonated most with, and then literally got so lucky that I stuck with her forever. Instead of, I feel like a lot of people, especially working with their classic insurance, will be like, okay, this person's in network, and there's only so many people who actually could get me in now or within 3 months. So it's like this really limited pool that can lead you to like jump from person to person because it doesn't feel right. So I loved that this was outside of that realm too, and less limited in that category. Yeah, I think that's everything I intended to say about this. I am so passionate about this subject, and it is so important, and these resources are around, but people don't talk about them. So if any of this resonated with you or helped you, please share it with other people. You don't even have to share this video, just share the information. And yeah, like, you don't have to be an entrepreneur with a small business and be without healthcare and without mental health care or anything like that. Yes, it still costs money, but it's way, it's like we deserve to invest in ourselves and take care of ourselves. And it's easy to let these things go by the wayside, but things come back to bite us in the butt. So taking care of ourselves now into the future is super important. And yeah, thanks for listening. I hope some of this helped. please comment if you think it was really dumb, or if you think it was helpful, or if you have questions, or if there was something I said I'd link that I didn't link, or anything like that. Yeah, thank you.